Marijuana has been around for centuries. In fact, the first known existence of marijuana dates back to 400 BC. Since its emergence, there have been lots of controversy over whether or not marijuana is good for you. Currently, marijuana is federally classified as a Schedule I drug, meaning it has a high potential for abuse and that there are no acceptable medical uses for it. However, that has not stopped states from going against federal jurisdiction to legalize marijuana. 33 states in the District of Columbia have currently passed laws legalizing marijuana in some form. The District of Columbia and 11 of those states have adopted the most expansive laws legalizing marijuana for recreational use. The rest legalize marijuana for medical use. With legalization laws of marijuana on the rise, the stronger the debate gets between whether or not marijuana's benefits outweighs its implications. Today we're going to be looking at the medicinal effects of marijuana compared to its implications. Marijuana consists of more than 421 components and more than 60 active cannabinoids. The two most well-described cannabinoids in marijuana are THC and CBD. These two components have major medicinal effects on the body when consumed. Epilepsy, for example. In June of 2018, the FDA approved the use of CBD to treat two rare and severe types of epilepsy, Lennox-Gastaut syndrome and Divert syndrome. Divert syndrome seizures are repetitive, prolonged, and potentially lethal. 1 in 5 children with this syndrome do not reach the age of 20 years old. In 2017, New England Journal of Medicine conducted a study to see if CBD could help with Divert syndrome seizures. The study consisted of 120 children under the age of 18 with Divert syndrome. Children were randomly assigned to receive an oral CBD solution or a placebo for 14 weeks. All participants remained on their usual medication. The results concluded that CBD successfully helped with decreasing the amount of seizures one had a month from 12.4 to 5.9. Marijuana can also help those who are suffering from cancer by eliminating some of the side effects caused from chemotherapy. Chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in one's body. Though effective, there are multiple serious side effects including nausea and vomiting. A Cancer Journal for Clinicians conducted a study comparing the effects of marijuana on chemotherapy patients. Patients were given combinations of oral and inhaled marijuana. The results concluded that both were effective in reducing nausea and vomiting in 14 out of 15 patients compared to placebo. Marijuana can also help with chronic pain. Chronic pain is the leading cause of disability, with it affecting more than 25 million adults in America. Opioid therapy is often prescribed for treatment of severe pain, but all opioids have the potential to induce nausea and cause addiction. Cannabis, however, can help with chronic pain by eliminating the pain itself and reducing nausea and vomiting induced by opioid therapy. Last year, a large review from the National Academies of Science, Engineering, and Medicine assessed the use of medical marijuana to treat chronic pain and approved marijuana as an effective treatment. Not only does marijuana have multiple effects on your body, but it also affects the environment and economy. When marijuana became legalized in certain states, it created multiple job opportunities by opening up dispensaries. Dispensaries are shops that sell marijuana. According to Cannabis Information Hub Leafy's 2019 Cannabis Job Count, cannabis directly employed more than 211,000 full-time workers in the U.S. Not only does marijuana provide job opportunities to those who are unemployed, but it also greatly affects the economy due to its popularity among people. For example, on the first day of Illinois legalizing marijuana for recreational use, there was $3.2 million collected in sales. Within the first month, Illinois generated $7.3 million in cannabis taxes and $3.1 million in sales taxes. With the money marijuana sales have generated, states have increased revenue and are able to improve their living communities. Along with any other medication, there are implications from using marijuana. With CBD, side effects are short-term and can include nausea, fatigue, and irritability. THC is known to have more serious short and long-term effects. Short-term effects can consist of lowered reaction time, increased heart rate, short-term memory loss, and hallucinations. Long-term effects can consist of the risk of addiction. According to the Encyclopedia of Drugs, Alcohol, and Addictive Behavior, 1 in 10 users become addicted to marijuana. However, for people who start cannabis in their adolescence years, the rate increases to 1 in 6. Other long-term effects can depend on the way marijuana enters the body. If smoked, for example, just as with any other smoking products, it can cause damage to one's lungs. Heavy smokers have greater risk for things like chronic cough, wheezing, asthma, lung cancer, and pneumonias. Marijuana can also affect your mental health. For example, marijuana can cause symptoms of mental health like hallucination, panic attacks, depression, and sleep disorders. However, after the effect of the drug has worn off, so do most of these problems. Marijuana can also negatively affect the environment. When marijuana farmers grow hemp plants inside, they use a lot of electricity, so much so that 1 pound of product equals 1.95 metric tons of carbon dioxide. Carbon dioxide is a harmful chemical that damages the environment's atmosphere. Growing hemp plants outside can also negatively impact the environment. When growing outside, in order to obtain the correct land, many marijuana farmers cut down trees, divert rivers, and destabilize whole ecosystems. Farmers also use pesticide and rat poison that are harmful to animals. In conclusion, medically, socially, and economically, marijuana has positive and negative effects. Each country-state has to decide for themselves if the positive effects of marijuana outweigh the negative effects. With every form of medication, not everyone is going to have a positive experience with marijuana. In order to make sure it works effectively, one's body needs to respond well with it. If someone lives in a state where marijuana is legal, they should first consult with their doctor before trying marijuana.